Hi everyone. This unit, or topic 1.4, is Introduction to Charting. So we're going to talk a little bit about how to chart, the importance of charting, describe the role of charting for the healthcare professional, distinguish the difference between objective and subjective data, which I'm pretty sure you already know, explain the advantages and disadvantages of charting formats, because there are different ways to chart, outline the ethical, regulatory, professional, and legal aspects of charting, summarize general charting rules, and then describe when to use the process of charting. Just want a reminder though, you must complete the CLPNA's online nursing documentation course. The link is on Moodle, and it's also listed right there if you just want to take it out of your PowerPoint notes and copy and paste it. It's free, it's easy to do, it's got some great information in it. I know it's nursing documentation as opposed to EMT documentation, but documentation is documentation. So it'll give you some great tips on how to document appropriately. So why do we document? Well, it's our legal document to register what, or to keep in record what we actually did for our clients. And so it communicates continuity of care, it makes us accountable. Legal implications, definitely. If it's not charted, it's not done. Quality improvement and risk management. So charts are taken after the fact, and they're studied to see how we can improve services that we offer to the public. And they provide evidence-informed practice. So documentation is really super important. The role of charting for you, communication for better care. It lets the people that are going to take care of your client after you've had your client know exactly what you did. They're going to give them baseline vital signs, something to build on. Provides accountability. It proves that you did your job. It shows exactly what you did and how you did it and the time you did it. Protection against litigation. So if something happens, goes wrong, your chart will protect you. It'll show that you did your job. And remember, if it's not charted, it's considered not done. And every legal case, our lawyers will tell you repeatedly, it's so important that you chart exactly what you've done. Two types of data, objective and subjective. Objective data is the measurements and observations we have. There's your vital signs, what you see, your client's eyes are puffy, what's broken bones, where's the blood. But it also involves sight, hearing, smells, and touch. So you can feel things, smell things. Adverse events, specific facts. Whereas subjective data is the information obtained from what the client said or what others, generally the family, said about the client. Your goal should try to be as objective as possible. To make subjective information more accurate, use direct quotes of what the clients or the families. What exactly did they say? Different systems, inclusive documentation is the most common, and documentation by exception. So an inclusive documentation system. We have a narrative. The narrative is telling the client's story chronologically in writing, with facts only and using sound judgment and professionalism. This is the most traditional way of documenting client information. The major disadvantage, though, of the narrative documentation is it's quite wordy and can be quite time-consuming. This client form may stand alone or be used with other tools such as checklists and flow sheets. It's an extremely important section of the client's health record that detects changes in a client's condition and resulting interventions. And then we have problem-oriented medical record. And it's a type of documentation method that uses a nursing process to describe clients' problems. We have focus charting or data action response charting, or DAR, it's typically called. It's a type of documentation that uses client assessment data and tracks the actions of the care provider and responses or outcomes of the client. So if you've done something, that's your action, and you're going to document the response. So what you see, what you've done, and the response to your actions. And then block charting. It's a method that's done within a given time frame or shift. It's not recommended as it opens up legal issues because you're leaving all your charting to the very end of your time with your client, and it's easy to forget something. So it's not recommended. Different ways to chart. You have your soapy, soapier, you have air, and you have pie. So SOAP and its variations are problem-oriented approaches to documentation that includes the healthcare process and which many interdisciplinary healthcare teams use. So subjective, what's been said; objective, what you saw; what's your assessment; and what's your plan. Now, SOAPy and SOAPier add an intervention, evaluation, and revision. AIR is AIR or assessment, intervention, response. Quick and easy way, a basic way for care providers to maintain efficiency and accuracy in their documentation. It's especially useful when an employing facility or agency has no specific documentation system in place already. So what did you assess? What was your intervention? And again, what was your evaluation? So all of these have the similar components. They just worded it a little bit differently. And the last type of documentation system is PI, or problem, intervention, and evaluation. Using this system, a care provider would ask the following questions and then document each response. So what was a client's problem? What did I do about it? What were the results? Again, exactly what AIR pretty much said. So advantages and disadvantages of these types of charting. So shorter form documentation systems are quicker, so more time efficient. However, you may miss something. Where the longer forms are more time consuming, but they're more complete, less likely to miss those little details, but extremely time consuming. It may take a while to find details that are actually important when reading. And you'll see that if you ever come across a chart and it's got this long, looks like a saga, big story, it's hard to pick out the details that are the most important. You want to keep it short and sweet. So documentation by exception. So this is a type of charting where you're only charting when there's something that's adverse, something that's happened that's not normal. So only significant findings or exceptions to normal findings are charted. Tick form or checklists may be used. Since the charting by exception system has much subjectivity, there must be clear guidelines for what the norm or normal are. So if somebody's blood pressure is such, is that norm or normal for them, and is there a deviation from that? Advantage, quick to the point. Disadvantage, it's a lot of subjectivity. Hard to determine what's normal or abnormal is. So what are the ethical components of charting? Why do we chart? So it's ethical duty to provide best care within your power. Communication facilitates collaboration. So the chart and what you're charting on your chart is the only piece of information that's actually going to get passed on to every healthcare provider that interacts with your client after you have. It allows your care to be communicated to everybody else. It's really super important. Facilitates autonomy by communicating client wishes, required in healthcare practice standards and regulations. We are all required as healthcare practitioners to document legally. So legal aspects. Client's record becomes evidence, and trust me, when something goes wrong and the patients are suing, their lawyers are involved, the first thing they want is a client record, and they're going to go through it with a fine-tooth comb. So you need to make sure you've documented appropriately. Failure to document equals failure to provide care and can be seen as negligence. Accurate documentation means positive outcomes. So the better you document the care you provided, the better the patient outcomes will be. Complaints to regular body or coroner's inquest will always go back to the chart to check on this. A health record tells the story of the client's situation, enables others to understand the treatments and care they received. From a legal standpoint, the client's record becomes the evidence if a lawsuit's initiated. So it's super important. Now, charting principles or rules. Document in the correct client chart or record. Sorry. Very important. Write neatly, legibly, and in ink. It has to be legible, right? How is everybody else supposed to read it if your writing is not legible? Use correct spelling and grammar. Use correct abbreviations. Document in chronological order and promptly. However, there's always things that you forget, and you can always put late entry, Correct errors or late entries as per standards. Sign correctly your name and designation. Identify by name other individuals contacted. So if you put a call into somebody, identify who you called and why. Maintain client confidentiality. Use not applicable or NA in blank spaces, and try not to leave blank spaces. Document medication omissions and refusals. Document only care you provide and never ahead of time. I don't know how many times, and sorry, this is a nursing story, guys, how many times I have watched nurses document that they've given the meds. As they're pouring their meds, they're documenting that they've given them. And then they go to give them, and the patient refuses them. And it's just, you don't document something until you've done it. Do not document complaints from staff, poor care, or accusations. They don't go on the chart. There's other forms for those. They're not a patient concern. So when to chart? After you take your measurements, after you've done vital signs, after performing assessments, after making observations, after hearing important quotes or information, after providing care or interventions, after an error is made, after an adverse event. We all have had errors in documentation. Mistakes happen. So put a line through it, one line through it, initial it, never use whiteout, never scribble out an error. It's always there. But that is the legal way and the correct way to fix a mistake in documentation. So that's it for the PowerPoints for this topic. Now it's really important that you go into your CLPNA charting modules. And on to 1.5.